just a 0, then we call it aught. It's one of those weird things where the more zeros you have, the smaller it is. So aught is bigger than 2-aught, is bigger than 3-aught, is bigger than 4-aught. We technically have like a number 1 and number 2 suture, but that's horse suture. We don't really use that in dogs and cats. The other thing that you want to pay attention to is the shape of the needle. So this is a reverse cutting needle, and it's a triangular needle, right? So if we take this out, it'll actually be a triangle. And what that does is it actually cuts through the tissues. And so it goes through the tissues more smoothly in terms of if it's a really dense piece of tissue, it'll actually cut and make its own path through. The downside to this is it's going to actually leave a bigger hole in the tissues. So something that's more delicate like intestine or bladder, we don't want to make a big hole, we want to make a little hole. But if we're using something like muscle or tendon, then sometimes it's easier to use a cutting needle. Skin's actually really tough, so we use a cutting needle on skin. The other one is this one. It's a taper, so it's a circle when you look at it end on. And so same thing, it's actually smooth all the way around, so it's a circular needle. So that taper point just pushes the collagen out of the way. So it has to work a little bit harder to get through the tissues, but the hole that it leaves behind is only the size of your needle. It doesn't cut into the tissues any further than that. Cool?